Morning, everyone. First of all, I want to explain where the Children's Sleep Charity came from. So it was down to personal experience, I'm afraid. I was once a very sleep-deprived mum. My background is in teaching, and I had a career in teaching children and young people with special educational needs and disabilities. I have 2 children, and one of them suffered from chronic sleep issues. I wasn't prepared for this. I knew that it was going to be tough in the early days. What I wasn't prepared for was 6 years of sleep deprivation. It's really difficult with sleep issues because there's not really anywhere to turn. So I asked a few friends, and they'd all got babies that slept perfectly and toddlers that slept perfectly, and that made me feel incredibly useless as a mother. Once it had gone on for several years, I did ask my health visitor for support, and she gave me a book on controlled crying. It wasn't entirely helpful. I didn't want to leave my child to cry. I was working full-time as a teacher. I didn't get any sleep. When on earth do you get time to read a book? But I got the gist of what she was getting at, and I am quite ashamed to say I did try it, and one night only, and it didn't work. There was nothing controlled about it. My friend is also a health visitor, so I had my confession time and told her that I was having real sleep issues, and she said, "Why didn't you tell me?" So she arrived, my fairy godmother, and she said, "Leave it to me." And I thought, this is great. I'm in the hands of professionals here. And she took him upstairs, and half an hour later, they were back downstairs, and she said, "I can't do it." And you know what? I was delighted, because it meant that he was faulty, not me. So off I went to see the GP, and I explained all this, and my GP said to me, "Children don't sleep. You shouldn't have had a child if you wanted sleep." Helpful. So I said, "Okay, what do we do?" And he said, "You're depressed." And I thought, "You're right, I am, yep." And he went to his prescription pad, and he prescribed antidepressants, and his exact words were, "Go away and get on with it." And I did. And several years later, he still wasn't sleeping. And it led me down a very dark path that we don't have time to go into here, and it's quite depressing, to be honest. I did lots of research around sleep. I became obsessed by sleep. I read everything. I went on sleep courses. And what I discovered is that a behavioural approach to sleep can be highly effective. So I put together a sleep programme, and after 2 weeks, he slept through the night. Yeah. So I started trying it out with other families, and they started sleeping too. And there was no controlled crying involved, and it appeared to work for all kinds of children. So one of my friend's children has got complex learning disabilities, cerebral palsy, physical disabilities, and he started to sleep better as well. So I'm not claiming 100% through the night, but certainly there were vast improvements. So in 2012, rather naively, I decided I'm going to set a charity up, because I'm going to stop one family going through what I went through. And if you set a charity up, people give you money, and then you can go out and help others. Well, let me just tell you now, nobody gives us any money. But to date, we're supporting about 30,000 families every year. So we are getting out there, and we've done much more than just that one family. So around 40% of children will have a sleep issue at some point in their lives. Okay? And that figure shoots right up when a child's got special educational need or disability. So it goes to way over 80% then. So what we know is we've got a lot of sleep-deprived children across the country, and very, very little support out there. What also happens is when the child becomes sleep-deprived, the parents become sleep-deprived, and it has a massive knock-on effect. So what we do at the charity is 4 things. We're based in Doncaster, but we cover the whole country. So one of the things we do is we deliver one-to-one sleep support to families, and sometimes that is to the young people themselves. We have very limited funding. In Doncaster and Bassetlaw, the CCG's commissioners to deliver these sleep services. They run at a 90% success rate, which is incredibly high, and we were featured on Panorama last year showing the methods that we use. We have just got a small amount of funding from Awards for All to put on some work in Leeds. We're looking for venues to hold sleep clinics at the moment, so if you are interested, do let me know. We also deliver training. So we're a team of 5 staff, we're tiny. So our model is that we train people to become sleep practitioners on an accredited sleep practitioner programme. And then they go and they spread the work nationally. So we've had people coming over from Ireland to do that. And we're out in Moscow this week talking about our methods too. We're going over to Alder Hey to train all the NHS staff in the paediatric department next month. So that's another way of us implementing our message. We train family support workers. So some local authorities have commissioned us to train them in a parenting programme around sleep. So what happens is we train the family support workers and then they deliver it in their localities over a 5-week period. This piece of work has been independently evaluated by Nottingham University, and on average children get an additional 2.5 hours sleep per night once the families have attended the programme. I just want to contrast that with melatonin. So some of you may be aware of melatonin, a prescription drug for children, quite commonly used in children with autism, and for some children it is required. So the men's trial in melatonin showed that those children got an additional 15 minutes extra sleep per night. So let's just go back and say 2.5 hours with the behavioural approach. So as well as the training, we also are involved in research. It's really important to me that our methods are evaluated, and we've just done a piece of work with Sheffield Children's Hospital and Sheffield City Council. In fact, we won an award for it on Thursday night from the Royal Society for Public Health. We worked with children who are vulnerable. The children had to have either a diagnosis of ADHD or be a looked after child in order to qualify for the support that we wanted to test. And the sleep practitioners worked with the families, and again the findings came out that those children got an additional 2.4 hours extra sleep per night. I know that there's some people who are particularly interested in ADHD here. When we pulled out the ADHD cohort of children, the figure was 2.6 hours additional sleep per night. And the fourth thing that we do is we campaign. Because there is not enough sleep support out there for families. It is not on the agenda anywhere. So last year I decided it would be a really good idea to write a manifesto for children and young people's sleep. And we got it supported by over 50 organisations, members of Parliament and the House of Lords. And we went and launched it in Westminster. Okay. So in terms of the impact of sleep deprivation, it's huge. It's closely linked to mental health. You've only got to think that if actually you're sleep deprived for a couple of days, how miserable you feel. It's linked with anxiety. There are links with postnatal depression. It's linked with children's inability to meet their full potential, to concentrate in school. It's linked to social isolation. There are lots of things that we can do to help to improve it, but there's no quick fix. It's about having a one-to-one programme with a really skilled practitioner. And I think the main thing as well for families is supporting you through making the changes, because quite often sleep issues can get worse before they get better. Okay, thank you.
Any questions on the sleep questions? Thank you.
I'm particularly interested in what you said about melatonin. I'm the parent there as well at NIPS Leeds, and I do the certain amount of forms for children with learning disabilities. And we often get claims not back because the child isn't on a sleep programme. Taking melatonin. We've got parents who don't want to use melatonin, which we respect, but just in sleep training during this really difficult situation. So I suppose, would you suggest that parents try melatonin or just hold out and don't? That's a really difficult one because some children do need the melatonin. So melatonin is a natural hormone that we produce when it gets dark, and there is some evidence to suggest that some children don't produce enough of that hormone, particularly children who've got a visual impairment. What we've done in Doncaster is our sleep services become part of the prescribing pathway. So before family get the melatonin, they have to come through our sleep service and get a behavioural approach to sleep. Because what we know is quite often it can improve the sleep issues without the use of melatonin, and obviously there's no side effects with the programs that we use, and we don't know really the long-term side effects of melatonin. It's only supposed to be prescribed in the short term for children. It's not actually licensed in anybody under 55 as well. So I think what we need is to have a whole country approach where there are sleep services like ours available so that parents have got a choice. And that is not uncommon, the outline that you've just given, and it is something that we are trying to campaign around as well, so thank you for bringing that on.